Hello, I am Dr. Soumya, and many people connect to us and then ask about Nadi treatment or just to check Nadi, BP Nadi, and Nadi Yoga, Nadi Ayurveda, and so many different questions. In reality, when we ask them back, they really do not know. At the same time, they think that walking in to a clinic and then getting the nadi checked itself is like a cure, or it's going to happen. So unless people understand that that is a myth and that does not happen that way, and nadi, by just looking at nadi, if everything is said and cured, then what is the whole use of having this, to study for so long, right? Yeah. See, nadi pariksha and then saying that there is something wrong or something right with a few minutes of few seconds sometimes of checking the pulse is a marketing technique which has been practiced around, and that is not something that a normal valid doctor can do. The Yeah, and see, if the classical text had some kind of a story, then it people were different. They were maharshis and they had that sadhana, they had that shakti, they had that energy, they could do it. But we are humans and we don't have such kind of thing. So it's very important to note that just by changing over or shifting over to nadi or ayurveda, it's not going to cure the things, or that is not the right way to do it. It's a good thing if you want to shift over to ayurveda. That's a good thing at any point of time, there's no doubt about it. But it has a procedure how to do it, and what are the steps need to be taken. So you have to follow those things. Without that, just going to a doctor and saying that I have this, and I have asthma, I have diabetes, give me medicine. And then the doctor would mix and match the medicines and tell them that this is what it is, and then you take it. That's not going to take you anywhere. Yeah, it might give you some kind of a result, may. I have not seen that kind of things happen. People take it for like 2 months, 3 months, and they say, and nothing is moving on, and some result is happening, and then they will stop and they will change another doctor, and things keep moving on. And that's why I make it a point to tell that these things would not work. Just walking in and showing, looking at the face of the doctor is not going to be helpful. I'm pretty clear on that. Please make sure that you understand this. The very reason I'm making this video is because most people have done that mistake, and when they do it without any proper evaluation and then proper analysis of what is the problem uh, that is going on in a person's system, when medicines are taken, what happens, it is usually a mix and match of medicines. What happens inside the body is not known, it's not seen. And then these kind of mistakes uh, make the disease much more deeper and more complex. It is very tough, it becomes very tough, and it can turn into different kinds of disorders, like branching out the roots. Okay, and the more and more self medication or anything that is available in the market, quote unquote, they write for this medicine is for stomachache, like that. They do it on marketing purpose. They have to write it for the legal things, they have to write it, but that doesn't mean that that would be the best medicine for suiting for that kind of a condition. Because health, illnesses originate because of many reasons, and that is why an analysis and evaluation is extremely important. So make sure that you think and then take the right approach. I do not know about other places, but in the place that I offer my services, you got to write the details of it of your problems in the enquiry form. Once the enquiry form is reviewed, we will get back to you. Then, looking at the condition, what would be the best way of action, that we will say. And it is not going to be a cheaper form of, like going for consultation whenever they want and all those things. It's going to be only programs, because we value it. And then when you start your working on yourself, it is like, especially with the way that my analysis and then approach is going to be, it is like a surgery. Okay, you can't just open it and then leave it. You understood? If it is a surgery, like, you will not open it and then just leave it, and whenever you want come and fix it. That is not going to happen, right? In the same way, what is going on in the body and what are the things that need to be changed has to be understood by me, and then we will work on that. Without that, it is not going to be helpful. One thing, once you start it, you have to complete it properly. Otherwise, it is going to be again like an open surgery and you're leaving it in the middle, right? And these things are very, very critical and very powerful also. Okay, see, surgery, at least you will know these are the things that needs to be done. Okay, but here in the clinical practice, there are so many factors that is involved in a person. It is not just the symptoms, right? There is other things. The lifestyle may be different, the food conditions may be different, the other medications that they have been on, and their mental faculties, and then any kind of previous trauma or health issues. All those has to be seen for anybody, for that matter, whether it is a child or an adult or an aged one. You cannot say that, oh, this person is aged and only this much, that much. No, in that case you will go to a different place. That's all. If the services need to be taken in the right ways, please approach us. You have to commit to what you're doing. Only then it is going to give you result, and that is going to stay there with you for a very long time. See, life is not just you take medicine, immediately some relief happens and then you move on. That is not like that. There are other factors also which you need to really consider. Hence, make sure, if you want to go in a proper way and in the way that you require long term health benefits very safely, then you approach us, fill up the enquiry form and do send it to us, and then write the details properly in that, and then be ready to get committed, and then you start working on yourself. Okay, bye.